One of the important topic, that is UTI, urinary tract infection. Here I am going to discuss about. First of all, you have to know about classification of UTI, that are classification of urinary tract infection. Mainly two classes there in UTI, that means UTI occurs in upper path and lower path. Upper path UTI that are known as acute pyelonephritis, chronic pyelonephritis, and interstitial pyelonephritis, renal abscess, and perirenal abscesses. In lower part, cause cystitis, prostatitis, urethritis. Both upper and lower UTI are further divided into complicated and uncomplicated. You have to know that women are more prone to urinary tract infections than men, as because the urethra is shorter in women than a man, so bacteria have a shorter distance to travel. For causing, some bacteria is there that must be enters into urethra, that means in kidney. Urinary tract infection, it may be occurs in kidney, in bladder, or ureters. So in case of female, urethra is shorter, you can see, but in so bacteria easily enters into urethra to the kidneys or bladder, you can say. In case of male, it have longer distance. So in etiology or risk factor, in mainly etiology, some bacteria is responsible for UTI. That bacteria may be E. coli, Escherichia coli, Klebsiella, maybe Streptococcus faecalis, Staphylococcus, Saprophyticus, and Staphylococcus, and some. And here you can see the common bacteria that are cause UTI. Those are Staphylococcus, Saprophyticus, Klebsiella pneumonia, Proteus mirabilis, and Pseudomonas aeruginosa, Streptococcus faecalis, Candida. These are the microbes or bacteria who is causing. Here you can see the some signs and symptoms of UTI. UTI in urethra, it causes urethritis, inflammation in urethra, and some symptoms of urethritis, that is dysuria, discomfort in voiding, urgency and frequency. In cystitis, it is lower UTI occurs in lower part. And in cystitis, some symptoms like pelvic discomfort, abdominal pain, pyuria. And hemorrhage cystitis, it confirms when blood. Next, you have to know pyelonephritis, and it is caused in upper part. So some symptoms like fever and chills, invasive nature. It is invasive nature, and confirmation test, you can see WBC is present in urine, and it may cause back pain. Symptoms of UTI, if it is occurs in babies, or you can say in infants, it cause failure to thrive, fever, apathy and diarrhea. In case of children, it causes dysuria, urgency and frequency, hematuria, acute abdominal pain and vomiting. You can see these are some viruses like rubella, mumps and HIV virus, some fungi like candida, histoplasma and capsulatum, and protozoa T. vaginalis and S. hematobium. These are some you can say microbes which cause UTI. Some diagnosis method is there for confirmation of UTI. For diagnosis, urine test is there, ultrasound, cystoscopy is there, blood culture or CT scan is there, and cystourethropy is there. Some test is there for diagnosis. And And in for confirmation of UTI, blood is collected and check different properties of blood, like and compares the normal and abnormal properties of that blood, like in pH. In case of normal pH, normal urine, pH is 4.6 to 8, but in abnormal, if UTI is there, their pH will be in pathogenesis, or you can say pathophysiology, there are 4 routes through where bacteria can entry into the urinary tract, that means that may cause ascending infection, or you can say blood-borne spread. Means through blood it enters into the urinary tract, or lymphatogenous spread from lymphatic system, through lymphatic system, and direct extension from other organs. Ascending infection means the microbes which cause UTI, it enters to the urinary tract through urethra, and it enters through urethra, and it's spread in bladder, which cause infection like. And second one is hematogenous spread, that means through blood this microbes is enters into kidney, and mostly Staphylococcus aureus bacteria is enters. Third, lymphatogenous spread is there. In case of men, through lymphatic vessels, these microbes is enters to the prostate and bladder, and after that it is infected. And fourth one is direct extension from other organs, that is pelvic inflammatory disease and genitourinary tract fistulas. Through these UTI. Some risk factors, that is aging, diabetes mellitus, urine retention, impaired immune system, and in case of female, shorter urethra, sexual intercourse, contraceptives, and case of male, prostatic hypertrophy, bacterial prostatitis is there. These are the some risk factors of UTI. One of the important topic, that is UTI, urinary tract infection. Here I am going to discuss about UTI. Of course is there. For elimination of risk factors, you have to take plenty of liquids, especially water. You have to and avoid to take feminine products. That means feminine product everyone knows. And after intercourse, you have to go for urination, and you have to drink cranberry juice. Use means for single dose therapy, you have to take some drugs like trimethoprim and sulfamethoxazole, methoxazole, and these are the combination of drugs: amoxicillin with clavulinate, and amoxicillin or ciprofloxacin or norfloxacin. Single drugs is there, side effects and specific contraindications is there. You have to remember some risk factors, that is aging, diabetes mellitus, urine retention, impaired immune system, and in case of female, shorter urethra, sexual intercourse, contraceptives, and case of. That's all about UTI. In UTI, it is not that much important, but for MCQs, they may ask. So thank you so much.